Last year, my mom became very sick. It was so unexpected. She was brought to the emergency room and was unable to make decisions for herself. Her doctor explained to me what was happening and asked me if my mom and I had ever talked about what approach to medical care she would want under these circumstances.
Advanced care planning is the process of thinking about, talking about, and documenting your wishes for health care. Advanced care planning is for everyone. The best time to start planning is when you are well. If you begin this process now, it will help your loved ones and your healthcare team understand your wishes for healthcare should you become too ill to communicate them. In this program, we will discuss the 5 steps every adult should take to plan for future healthcare decision-making. When creating an advanced care plan, take time to consider your wishes regarding healthcare. You might find it helpful to think about your views on prolonging life and quality of life.
Mom and I began having conversations about her wishes and values about healthcare a few years ago, after my dad passed away. Even though it was a very difficult time, I felt comfortable knowing what my mom wanted, and I was able to share that with her doctor. Thinking about my own wishes and values ahead of time will help me prepare for any decisions I may have to make now or in the future. Even though I'm healthy, I want my family to know my feelings about future care. And that way, if they're ever faced with making decisions on my behalf, they'll have that same peace of mind.
Over time, your wishes and values about healthcare may change. Your health may change, or your circumstances may change. That's okay. Changes can and should be discussed with your healthcare team and your loved ones whenever they arise.
Hi, Mrs. Barrick. How are you doing?
Hi, pretty good, thanks. How are you?
I'm fine. Thanks for asking. So what brings you in today?
If you have an existing medical condition, it's important to talk to your doctor or other healthcare providers. You may hear the words diagnosis. That is, what your medical condition is called, or prognosis, what you might expect to experience in the future as a result of your medical condition. You can learn about the possible medical treatments for your condition and what to expect from these treatments.
While we can never predict exactly what life will bring, I can talk to you about what other patients with your condition have experienced.
If you do not have a known medical condition, it's still important to consider what would guide your decisions if you were in an accident or had a sudden medical event such as a heart attack or stroke. Unexpected or sudden medical events can leave us unable to make our own healthcare decisions. Other medical conditions can slowly take away our ability to communicate or make decisions about our healthcare. This is why another important step in the advanced care planning process is to choose and legally appoint an agent who can speak for you in the event you are unable to make healthcare decisions. An agent could be anyone you choose, such as a family member or close friend.
And you know, if it comes down to it and I'm so sick that I can't speak, I'm hoping that you'll be the one to help my doctors and nurses make decisions about my future care.
Well, of course,
Some of the things you may want to consider when choosing this person are: do I trust this person to make healthcare decisions with my healthcare team based on my values and wishes? Are they able to communicate clearly? Would they be able to make difficult decisions in stressful situations? Is this person willing and available to make decisions for me if I were unable to make healthcare decisions for myself? It is very important to discuss your values and wishes with the person you are considering to be your alternate decision maker.
One of the things that's really important to me is being able to spend quality time with you and the girls. Girls, can we have a family meeting?
Sure, Mom.
Likely the most important part of advanced care planning is the conversations that you have with your doctor and loved ones. Some people may find it difficult to talk about their wishes and values for healthcare. It may bring up uncomfortable feelings for you and those you are speaking to. This is normal. Having conversations over time will help your healthcare team and your loved ones know what your wishes for healthcare are, should you ever become unable to make healthcare decisions yourself. These conversations can also be helpful in determining the medical approach to your care or goal of care that best reflects your wishes and your health circumstances. The next step in advanced care planning is to document your plan. In Alberta, the legal document for this is called a personal directive. In a personal directive, you can name an alternate decision maker to be your agent. This is the person who can collaborate with your healthcare team if you are unable to do so, and make healthcare decisions for you in keeping with your wishes. You can also write down any other information about your wishes and values related to healthcare in the personal directive. The personal directive only comes into effect if there is ever a time that you are unable to make decisions about your healthcare. It can be helpful in reducing conflict or distress. It brings comfort to those who you are close to because it clearly states who your healthcare decision maker is and can give direction on your wishes. Your wishes and values may change over time. This is normal. Your advanced care planning, including your personal directive, can and should be reviewed anytime you have a change in your health circumstances or your wishes and values. If you would like more information about personal directives, you can contact the Office of the Public Guardian for assistance. We hope that outlining these 5 steps has helped you understand the process of advanced care planning. This is a difficult topic. Few people like to think about sickness or what they might want at the end of life. Please take the time to speak to your family or someone close to you and speak to your doctor, nurse, or other healthcare provider. This is a gift to your loved ones. Ensuring your wishes are known and legally documented with a personal directive may bring comfort and peace of mind to you and to those who may have to make medical decisions on your behalf.